My name is Dr. Ronald Luke. I'm a GP by profession, but with interest in diabetes management. I am working for the government at Tonga Diabetes Clinic. I'm currently under Greater Francistown DHMT. Merck Foundation offered me a course in diabetes management, like 2 courses. First one was Diploma in 2019, and the second one was Masters in Diabetes Management, which I completed in 2021. The course offered to me was excellent because most of the things that were included in the course is what we do every day here at Tonga Diabetes Clinic. The content was good. It was something that we built up from what I learned at school, and now it was a bit in details, So now we're getting to know what really diabetes is. So it was really good, and the faculty, how they design it, I really liked it, because you have your own tutor and you always talk, communicate. There are several success stories after receiving that course. First of all, now we take diabetes very seriously around here. The problem with us is that the clinic was there before the course, before I enrolled in the course, and I was still here at the clinic. But after the course, everything went smoothly. I built up confidence on how to manage diabetes. I built up confidence on how to initiate insulin, which was really not a thing back then. I inspired one of the nurses to do the course here. She enrolled herself. She was self-sponsored, because most of the time I will discuss the content with some patients. I will discuss with her. Then she get to like it, but she was willing to enroll herself, and she finished the diploma. We do on occasionally we do outreach programs. We go to some clinics around, and we talk to them about the diabetes management, from diagnosis up to management of complications. Our center, when it started, it was like a primary center, but now it's functioning like a tertiary center, because we receive referrals from other centers. We no longer refer many patients to Nyangabwe or to established tertiary centers. Even most of the time we get patients from those centers to us, and we take care of them. Other thing, what I did after completing the course, I have been invited to make presentation, formal presentations, where there will be specialists and other medical doctors and nurses. I did the online one, and I did the physical one, several of them. So the course really helped me to have that knowledge on management of diabetes. For me personally, it helped me to go. I'm here right now. I was supposed to go somewhere, but because of my knowledge on diabetes management, we spoke with the bosses, and they retained me here, to manage diabetes patient. The other thing is, with interesting cases we have, some patients you would go to Nyangabwe, maybe due for amputation, but because they know what we can offer here, the management of food, diabetic ulcers, some will discharge themselves there and say, okay, let's go to Tonga and see what they say there. Yeah, some of them we have prevented some amputation. Let me just say we prevented amputation because those, when we take care of those ulcers, some of them ended up healing. Okay, yeah, and patient satisfaction is, yeah, they are satisfied. Before we enrolled the course, even before this clinic was started, most of the patients were go to private, hoping for better care there. But now, some of them are coming from the private practitioners to us because it's relatively relatively the same, except that here sometimes we don't have proper medication, proper equipment, and other things. But the knowledge of the course and the knowledge of management of diabetes and the knowledge of management of complications of diabetes, we really know them, and we really provide the service to patients who really need them. Or refer the course because to someone else who is interested, because I have benefited a lot. The knowledge and the experience and the confidence, like it's all about making proper decisions, individualizing treatment. The course really helped me on that aspect, like individual treatment. Now we can, because I went through this course, I can call the pharmacist and ask them about the drugs that we didn't even know about them before, because patients are different. So we look at the patient profile and we treat them accordingly. So I can do that because the course taught me we have to individualize treatment. We have to encourage patients to be involved in the management of diabetes. So really, I always tell my colleagues that if possible, they can join the course. And I always tell them that when the applications are out, they should always try their luck. And I'm there for reference if they need one. I would like to thank Merck Foundation for giving me that opportunity to see diabetes management at a different perspective. Yes, before I was, but medicine career is growing, like every day, things are changing. So Merck Foundation offered me that course. It offered me the opportunity to see what's current. Because sometimes if you just do it by yourself, you won't get the proper knowledge. But through a course like this one, even the research course of the masters, it helped me a lot. So I'm now be able to do minor research studies by myself. Yes, I really thank Merck Foundation for that.